We will begin with a report, the Berks County COVID-19 data report. The report is being presented by Brian Gottschall, the director of the Berks County Department of Emergency Services, as well as the lead on the Berks County COVID-19 leadership team. Brian Gottschall.
Good morning, Commissioner. Thank you very much. Yes, our report for the week of May 20th here. First thing we want to look at is our cases and testing slides. We continue to see great downward progression in the number of cases when smoothed over the 14-day period. As we always look at them, we can see that we're back down to numbers that we haven't seen since back in February, March, and prior to that we were seeing back in the late fall prior to Thanksgiving. So, of course, we hope to see that downward trend continue. We've got the seasonal change. We obviously saw an incredible benefit last year during the seasonal change. And then this year, we're doubling down on that by getting more and more folks in the population vaccinated. So good news all around on the case counts. Our hospitals continue to show lower and lower numbers. Again, as always, from the beginning, we show suspected and known cases of COVID in-house. The known cases of COVID are significantly below these numbers here. So both hospitals in very good shape and happy with how things are developing there. Our deaths continue to be concerning. The curve has flattened out, as we've mentioned over the last couple of weeks, but also, as we've talked about, the deaths are the lagging indicator, and we unfortunately don't see the deaths come down as quickly as the cases come down. In essence, people who have already been diagnosed and are sick enough that they're going to ultimately die, that process has to continue on until we see the deaths match the case count diminishing. But the curve is on a downward trend like the case count curve is, just not happening as quickly. On vaccine administration, with respect to raw numbers, we moved up another level in the Commonwealth this week to number 9 by fully vaccinated as compared to last week where we were number 10. Also, we have improved our position per capita from 41st and with respect to fully vaccinated, and 28th with respect to first dose on board at least. And I apologize for the 28th there. This again is as of May, and I apologize, another typographical error. That's actually as of May 14th, not May 10th. So our numbers are looking a little bit better, although still not where we want them to be, particularly when you consider per capita, or another way of saying that, percentage of the population. We take a look at our goal thermometers, and we remember that in Pennsylvania, the goal that has been given to us is 70% of the population over 18 years of age, and the state is looking to CDC data to aggregate that, and we are right at a solid 50% of those over 18 years old in Pennsylvania have been vaccinated at this point. DOH tracks their data based on eligible, and right now their data for eligible still shows 15 and older. They have not yet incorporated 12 and older into these numbers, but based on 15 and older, we are at 38.1% of the Berks County population who has been fully vaccinated. And when we look at that across the Commonwealth, the spread in counties goes from a low of 21.5% in Fulton up to almost 62.5% in Montour County, with some counties making very significant gains. And I think we're going to see other counties move into that kind of top position over the next few weeks as first doses get their second doses and become fully vaccinated. But we'll look at that in future weeks. And then to kind of summarize that up in Berks County, as we said, right now, 38.1% of the eligible population is vaccinated. We want to get at least another 57,000, 58,000 residents raising their hands saying that they're willing to take the vaccine to hit that 70% goal. And we use our greater than there because these numbers are based on everybody eligible, 15 and over, not on 18 and over, which is what the CDC and governor's goal really is. So we kind of have to round the numbers a little to get to that 70%, but we know we need at least another 57,000 adults to raise their hand and say that they're interested in taking vaccine. And just to remind everybody how you can go about doing this, www.doyourpartberks. or the call center number 888-712-2772. Either way to get yourself an appointment, either at the county BCHC sponsored clinic in Muhlenberg or any of the other clinics that are operating. And just emphasize, at the county clinic out in Muhlenberg, walk-ins are okay. Not preferred. If you can make an appointment, that's better for everybody, you and us. But if the thing that's going to get you to go in and get your vaccine is just walking in the door without an appointment, everybody's perfectly fine with that, and you can feel free to do so. That's all I have, Commissioner. Unless you have any questions, I'm wrapped.